Hi, everybody. Welcome back to Community Corner with Assisted Living Locators.
Today, we are very pleased to say that we have our good friend Kim Cyr with Interim Healthcare on the line with us today. And Kim's going to talk about some things that we run into a lot of people that don't understand all of the benefits that you can receive in an assisted living, all of the supports that you can receive in assisted living. And this is something that Interim does day in and day out. So Kim, it's awesome to have you with us today. And if you want to take a couple minutes to let us know about your role with Interim and what Interim does for folks in the state of New Hampshire.
Thanks so much, Glenn and Christy, and thank you for having me on the Community Corner. I'm really excited to be able to educate people on what we do at Interim Healthcare. Interim Healthcare is a skilled home healthcare agency, and so we are providing services to people at home. And we're providing skilled home care services. And that is wherever somebody calls home. So a lot of times home is an assisted living facility. Now, Interim Healthcare is providing these skilled home care services. We have 6 offices in New Hampshire. So we are providing home care and assisted livings all the way up into the Lakes region, all the way down the central part of New Hampshire, into Nashua and Salem. We're over the entire seacoast. And we're also over in the western part of the state, where towards Milford, Peterborough, and out towards the Keene area. Now, I'm the transitional care coordinator, and yes, that's a mouthful, but the transitional care coordinator, my role is to educate people so that everybody can get the services that they could benefit from when they're moving into an assisted living, whether that's moving in from their home in the community, or moving in from a hospital or a skilled nursing facility setting. Everybody deserves a level of home care services so that that transition from home to the assisted living is the most successful for them, making sure that they reach, their biggest potential to be successful in the assisted living. So my role, I do have a healthcare background. I've been in healthcare for over 20 years. I've worked in the hospital setting, in skilled nursing facility settings, the assisted living. I've done hospice. And now my favorite role is the home care, just to be able to bring that service to people in their homes.
That's beautiful. And to your point, regardless of where home is, I think it's phenomenal that you folks are able to help support people, even if it's on a temporary basis or a long-term basis, to be able to call wherever home is home. And I think the services that you bring are invaluable with keeping people out of a more institutional or clinical setting and keeping them more comfortable. So kudos to you guys for what you do, covering the entire state. We can testify as a lot of work, so we love working with you and your services as well, and you're very well thought of throughout the state of New Hampshire. So we appreciate you being on today, and kind of to get into that sort of meat and potatoes of what you can do for folks at home, regardless of where that is. I know for us, one of the biggest questions that we get is, what kind of home health care services will my insurance pay for in an assisted living?
So great question. So there's a lot of pieces to skilled home care, skilled nursing services, physical therapy, occupational therapy, speech therapy. So the skilled nursing services, those are provided by a licensed nurse. And the focus of that nurse is to evaluate a patient's plan of care, monitor their medical condition, especially after a recent change in their condition. So that medical monitoring could be medication management, could be diabetes management, assessing someone's cardiopulmonary status, their nutritional and hydrational input and output, their skin assessment. So there's various pieces to what that nurse is going to do. But one of the biggest things is that that licensed nurse is going to educate the staff or the caregivers in an assisted living as to what that patient's plan of care is, what the individual services that we're setting up for them, so that medically they remain stable and that everybody's on the same page about what their plan of care is. So In addition to the skilled nursing that someone could get, they could also get physical, occupational therapy or speech therapy services. And those services are designed to increase somebody's level of functioning. If somebody was not at their prior level of functioning, those therapy services can bring them as independent as they can possibly be and as safe as they can be in their new environment. And again, those services typically come after a recent change in their condition.
You did just touch on a little bit change in condition. Can you give me some examples of that?
Oh, absolutely. So a change in condition is a change in someone's medical or functional condition that kind of indicated some kind of decline. So a medical decline could be somebody with a cardiac illness, like congestive heart failure, or if somebody had a heart attack, or if someone had an exacerbation of their congestive heart failure, that's kind of a new acute condition. Pulmonary issues, somebody with chronic obstructive pulmonary disease that maybe had an exacerbation of that COPD, or another respiratory failure or issue, a recent stroke, a heart attack, any other recent infections like a urinary tract infection or pneumonia is also considered a change in condition. And sometimes, a lot of times, people would have a functional decline as a result of their medical decline. So a functional decline, somebody who was able to walk independently before, but now it looks like they need a walker, and now their gait is a little shuffled. Or they were transferring in and out of bed, maybe only needing a little bit of assistance before, and now it takes almost 2 people to transfer them out of bed. Any decline in their toileting, or any decline in their activities of daily living, something that they were able to do prior that now maybe they need a little bit more assistance with. So all of those are considered a change in condition. And in order to qualify for the home care services, they do need to have some sort of recent change in that condition in order for us to put them on the home health care services benefit. And they don't necessarily have to use all the services at once. You know, somebody doesn't have to have nursing and PT and OT and speech. Maybe somebody just needed nursing services and some speech therapy services, or maybe they just needed PT and OT. So there can be different combinations to receiving those services. They don't have to be all at once.
I know for me personally, one of the biggest questions that I get with folks that have gone through some sort of changing condition and maybe are in a skilled nursing facility for a rehab or something like that, and something that I grossly did not understand when we got started with this. But can you tell us a little bit about the difference between like a physical therapy and an occupational therapy? I think a lot of people receive therapy and they don't really understand what the difference is between a PT and an OT situation.
Absolutely. And that's a question I get asked a lot too. As far as the physical therapy is concerned, physical therapy is really focused on everything that you're doing with your lower extremities. So, you know, everything, I always say PT is from the waist, your waistline down, your lower extremity strength. Physical therapy is, you know, looking at that. They're trying to increase people's lower extremity strength. They're trying to assess their balance. They're trying to improve their balance scores. They're always doing falls risk prevention, assessing somebody's risk for falling, and, you know, how do we prevent that, and educating them to increase their functional abilities for everything that you do, from walking to getting in and out of bed to transferring in and out of the chair. Whereas occupational therapy, the easiest definition is that everything you're doing from the waistline up. So everything you're doing with your upper body, all your activities of daily living, you're transferring in and out of the shower, you're washing yourself, shower, bathing, dressing, grooming, all your hygiene therapy. And I don't want to forget about speech therapy in there also, because sometimes there's a misconception that I don't need speech therapy because I can talk fine. Therapy, besides focusing on things like swallowing, speech therapy, I think, is great for a lot of people, especially when they're going into assisted living, because speech therapists focus on cognition and memory. And, you know, occupational therapy works on things like cognition also, but really the speech therapist can assess how somebody's safety awareness is. Are they aware of their environment, aware of their surroundings, working on their cognition and their memory when they're in assisted living, I think is crucial, especially when you're first moving in. You know, I had a client, you know, a memory care assisted living. And that person was struggling, you know, with their cognition, being able to remember things. The speech therapist was trying to develop a memory book for that person, so that not only did it have like pictures of their family in it and listing the names of who those family members were so that they could remember, you know, or at least recognize them more on a daily basis. But that speech therapist put together a list of all the activities that that person liked to do in assisted living, or all the activities that they had done in their past, so that she could educate the staff, when the activity staff in the assisted living, to be able to do those particular activities with that person, to bring about their quality of life in the assisted living, so that a lot of times that person might not be able to remember the activities that they once loved, but, you know, some things are like second nature. And once they're sitting there, you know, doing the activity and knowing that there was a good plan of care for that person and that all the staff in the facility were educated on that person's plan of care, it's really providing the best quality of life for them possible in assisted living.
That's great. Thanks for sharing that. I think that's something that's important for, that's important for the client as well as the community.
Absolutely, especially the speech portion. I think a lot of folks don't understand the benefits of speech therapy, regardless of cognitive ability. So great points.
Yeah, that's fantastic. We do get this question a lot too. Can our loved ones still receive therapy if they just had services at home or in a skilled nursing facility prior to going to assisted living?
Yeah, so the short answer is yes on both. But there's a little bit more to it. People can access their home care services numerous times. So even if somebody had home care services, maybe they had some physical therapy 4 weeks ago before they transferred into assisted living. The biggest piece to qualifying for home care services again is going back to that, having a recent change in condition. So maybe they had physical therapy at home for a fall they had 8 weeks ago, and they got therapy for 3 or 4 weeks, and then they were doing a little better, and now, mom started to decline a little bit, and now we're going to move her into assisted living. But she comes into assisted living, and it's a new environment, and it's a big change, and maybe, they're starting to decline a little bit, and their condition changes, as long as the physician is ordering more services and identifying that change, then they can qualify to get another set of rehab services in their new environment. Maybe doing this new environment in assisted living, which is different for this person, and they can definitely benefit from having some rehab services again. People get confused, especially when they're in a skilled nursing facility and they're transferring in to an assisted living. Maybe they exhausted, in the nursing facility, they said, you've plateaued with rehab, you don't qualify for any more rehab, now we're moving to assisted living. But the rehab services that they provided are under a different part of their insurance benefit than the home health care benefit. So when they leave that skilled nursing facility, obviously they were there for a change in condition in the first place. So going into an assisted living, they can qualify for a different part of their insurance benefit, which pays for the home health care, even though they may have exhausted the PT, the OT, and the speech and skilled care. they can still reaccess their home health care benefit in the assisted living, which can include all those services as well as nursing if it was needed.
Wonderful information, and we get that question quite a bit. And as you can imagine, as a follow-up question from that, the who pays for it. Can you touch on what insurances pay for that home health care benefit?
You know, it's amazing how many insurances have a home health care benefit. And Interim Healthcare, I can honestly say, takes the bulk of insurances. You know, there's very few insurances that they don't take. And to list every single insurance that they do take, it would take too long. But I am going to touch on some of the major insurances that do pay for home health care and the coverage that they have. So the primary, Medicare, typically like a Medicare Part A, people have Medicare Part A and sometimes Medicare Part B. Medicare Part A, which pays for the hospital, it also pays for skilled nursing facilities. Medicare Part A also has a home health care benefit, and it is covered at 100%. So Medicare is really one of the primary ones, and it's nice having that 100% benefit. Now, a lot of people today, they don't have their straight Medicare anymore. Maybe they signed up for a Medicare Advantage plan or what they call a Medicare replacement plan. Those mirror the Medicare guidelines. So again, you know, there's full coverage under those Medicare replacement plans for home health care services. In addition to those, commercial insurance like your Anthem Blue Cross Blue Shield, Tufts, Harvard Pilgrim, Cigna, those all have home health care benefits as well. Interim Healthcare also takes workman's comp. There's several workman's comp plans out there that also, you know, will pay for home health care, as well as the VA. VA is also, you know, requires a prior authorization for the home health care benefits. But, you know, between all of those insurances, if anybody ever had a question on, you know, is Interim Healthcare in network for my insurance, I'm always happy to, you know, check somebody's insurance and find out what their benefits are. If they didn't have Medicare or Medicare replacement plan and they were concerned, do they have a copay? Do they have a deductible? We can certainly always look into that for them and let them know what their benefits are.
Awesome.
Nice, very nice. What other criteria is involved to receive home health care?
So, you know, there's a few other pieces in order to make somebody eligible for home health care services. Being homebound is one of the criteria that a lot of Medicare uses, especially for somebody to qualify. Now, being homebound just means that it's a taxable effort to get outside. Now, I can honestly say that a lot of people moving into assisted living, a lot of them aren't going out to lunch every single day with their family. Once they get into assisted living, they're really kind of trying to, you know, adapt to their new environment. They might not be going out on bus trips every other day. You know, somebody who has the ability to get out easily and get on the bus and go shopping 3 times a week might not be homebound. But somebody, when they first get in, you know, they're staying there. Maybe they have had a recent change in condition and they need to, you know, remain in place for a little while. That's, you know, when that homebound criteria comes into play. And that's one of the criteria to be eligible for home care. The second piece is having a physician who's going to follow your plan of care. So a physician needs to order the home care services, and they also need to be involved with that person's plan of care, identifying the recent change in condition that they did have, which is the reason that they're ordering the services in the first place, and then having our staff be able to follow up with a physician, or the staff in the assisted living being able to follow up with that physician throughout their plan of care through the services.
So I think that's some wonderful information. Go ahead.
Oh no, you go.
I think my God, we've touched on just about most everything at this point. At least the majority of the questions and concerns that we hear from folks. I think just sort of as a last question, can you talk a little bit about how often these services can be provided to people?
Oh, absolutely. Yeah. So that usually is the number one question. How often is someone going to come? Well, services under your skilled home care benefit, they are short-term services and they are intermittent. So because everybody's plan of care is individualized, I can't say specifically how often is that nurse going to come? How often is my dad going to get physical therapy or occupational therapy? Because each discipline that is ordered for services, they go out and they see the person in their environment and they do an assessment on that person. And they are assessing, their entire plan of care, what their limitations are, what they need to work on, how long do they think it's going to take to achieve these goals before we can discharge from the home health care services. So the services vary as to how many times a week, but the services, because they're physician driven, based on what the physician feels like that person may need. If somebody needed skilled wound care and it had to be done by a skilled nurse 3 times a week, and that skilled nurse may be assigned 3 times a week. But somebody else who maybe just is having a little bit of, needing help setting up their MediPlanner or diabetes management or, something a little on the lighter scale that may not require daily skilled nursing services, maybe they are only going to see the nurse 1 time a week. So it would vary. Same with the physical and the occupational therapy. Those therapists are setting up home exercise programs for the person in assisted living so that the caregivers and the staff in the assisted living can help follow that home exercise program and do the exercises with that person on the days that the therapist isn't going to be there. If somebody wasn't going to meet the criteria for home health care services, our goal is to transition them or to refer them to somebody who can provide the rehab services. So there's a lot of outpatient providers that are providing rehab services to people in assisted living facilities, and we like to try and transition them from our services over to the outpatient services. When our services are starting to plateau, we want them to have an extension of their rehab. And so we would transition them from the Medicare Part A home care services to a Medicare Part B outpatient service. That most assisted livings, a lot of them in this area, have outpatient services in their building so that these people don't have to go elsewhere for additional rehab. They would just get an extenuation of their rehab services after we finish. I'm not sure if that completely answers the question.
Wow, I've been doing this for over a year and I just learned so much in this short period of time with you. Mind blown. So thank you. I know you and I have spoken a couple of times since we've been off the road and at home. We're a couple of road warriors. I know how much you are missing being in front of the people that you serve every day right now. So thank you for taking some time today to really educate Christy and I, and hopefully some of our viewers, on something that I think a lot of people don't even know is an option to be able to get them back on their feet or help a loved one to be able to get there. So thank you so much. That was an outstanding breakdown of the vast majority of questions that we get from folks. Certainly if someone's looking to connect with you, they can always reach out to Christy and I. We will also make sure that your cell phone number and your email are in the contact information. And if people want to reach out to you, I'm assuming that you're available most of the time to be able to answer questions or help hook them up with services.
I certainly am. And I always stress to people, definitely call me, because if you have any question about what services your person could get going into an assisted living, whether Interim is going to be the provider for them or not, I am a resource for so many people based on the fact that I do have a vast majority of experience in healthcare. I have seen so many. I just want to be able to educate people on benefits that they would be eligible for and could qualify for their insurance to pay for, because they deserve it to be successful in their new homes. And thank you guys so much for everything you're doing to try and bring people, into a nice new home and be successful when they get there.
Thank you. It's been awesome to work with you for the last year, and looking forward to doing a lot more of that as we move forward. Yeah, I think, do you have any questions, ma'am?
No, thank you so much for your time. We definitely learned a lot. It was a lot of great information.
Absolutely. I'm looking forward to watching this again, folks.
Mhm.
So thank you so much for your time today, Kim. It was awesome to get that information out of you, and we hope you have a great day, and we hope to see you in person soon.
Thank you so much.
Bye-bye.
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 Now I always wait a second because I get up way too fast and hit the stop button. It's a bitch to edit it.